And now we're gonna discuss about the exercise as medicine concept with a doctor. His name is Donny Kurniawan. He is a sports medicine specialist at Metropolitan Medical Center Hospital. Good morning, Dr. Donny.
Morning, Doc.
Good morning. How are you guys?
We're good. We're fine. Thank you, Doc.
Thanks for joining us this morning, Doc. So let's talk about that statement that Shafir just mentioned. Exercise as medicine. What does that mean?
We want to try like an exercise, treat as a medicine. So if you want to prescribe some medicine, you have to know the doses, you have to know the frequency, you have to know the benefit of it.
True.
The same as exercise. So we want to share the knowledge or share how to exercise to our patient with kind of medicine path. Like exercise have to be like frequency, the intensity, what kind of exercise we want to our patient know, so they can do it precise as what they need.
Okay.
And I'm curious, is this used more as a preventive measure to make sure one doesn't get injured or sick, or can it actually be used to prescribe to somebody who is to get better?
No, we have to back to the round one and what is sports medicine? Sports medicine, we only like treat two kind of population or two kind of condition. The first one is we use medical knowledge for people who exercise, and we use the sport or exercise science to treat the people with health condition. So we doesn't just treat the preventive, but we try to cure, we try to help people, or we try to deal with diseases that come from the lack of exercise, or can be helped with the physical activity intervention.
Oh, okay.
Yeah, which would make sense. For example, if somebody has high cholesterol, yes, you can kind of fix that through nutrition, but if you exercise, that will speed up the process twofold. And it would make it that
it
much
can
better.
help you from the inside as well.
Just like you with your injuries.
Exactly, because it happens to me. I got injured, and now I go to gym. I hire a personal trainer, and I think my knee is getting better.
I hope so.
I hope so. So I feel the benefit from doing the exercise as a medicine. So, Doc, when was this established?
All right. I'm not saying like exercise is medicine. Exercise is medicine. It was published probably around 2007 by Robert Sales from American College of Sports Medicine. They want to bring up the ideas for the physician to give exercise to their patient. As you know, that's not many physicians know how to exercise. The physician don't like give exercise to the patient. There's some issue, but American College of Sports Medicine try to build it. It's very long journey. It's very hard journey to give an exercise to the patient. And then, 2010 until now, I think.
Okay. So, so this is actually surprising to me because you would think a lot of doctors always say, right, you should get regular exercise, you should get plenty of rest, and you should eat well.
Right.
But we don't want to go down this path because there's always an argument on whether you should use medicine or exercise.
Yeah.
And if you just exercise at home, it doesn't make
it will be useless, right?
Well, no, it's not that. It doesn't earn money for anyone. Whereas pharmaceutical companies would probably rather have you on medicine as opposed to you exercising. But let me ask you this. If we talk about exercise as medicine, how do you determine what would be the right amount in order to cure an ailment? Because with medicine, I know we just follow specific prescribed doses, but for exercise, how do you come up with that? Because some people can actually overdo it, just like with medicine.
Yeah.
I myself used to think more exercise the better.
Will get rid of my illness.
Everything. And then suddenly I overtrained and then I ended up injuring
and I got
myself,
very tired.
Right. Exactly. So how do you determine that, Doc?
Okay. Did you guys know that fitness can measure, have the objective value, like when we do like lab test or something like that? So what other people don't know is fitness can be measured.
Oh.
So when we treat a patient, first there's a kind of 5 health-related fitness that according to American College of Sports Medicine. The first one is cardiorespiratory fitness. we need to some limit that you can do like running or jogging. So you, if someone the stairs, like maybe 2 floors, and then he just run off that, that's not fitness. That's not fitness.
Okay.
You want to get achieved, you can do a hard work, but you can still have energy to do like in leisure time. You can do like household, or you can do playing with your children. That's fitness. So another part is body composition. Did you know that we don't use BMI anymore, body mass index? We don't use it anymore. What we use now is like fat percentage, muscle mass, and then visceral fat, biological age. We use that now. So it's like a very precise measure to know the limit of the fitness of the people. So when we give the patient how to exercise, we start from there.
Okay, so there's two ways to do this. You can measure and track the progress of somebody's, say, fat percentage, lean mass muscle, and things of that sort.
Yeah.
Because BMI is outdated, I believe.
Yeah.
You can have a good BMI and you could still be, overweight or
Yeah,
underweight.
or you can get the high cholesterol level sometimes.
But I guess what Doc is saying as well, you can also measure somebody's fitness in the sense of, is it true then, Doc, if you want to measure someone's fitness as well, perhaps you could track their heart rate as they do a series of tests, and then you can find out what their limits are, and you can prescribe exercise based on that.
Yeah. When the patient come to us and he or he doesn't know the health condition or what underlying disease is, so we do like PARQ maybe. It's like a questionnaire to know the underlying issue, or we can do the medical checkup. So we know the risk of the cardiovascular diseases.
Okay.
So when we do like fitness testing, all is clear, all is ready.
Right.
We don't want to check fitness testing because it's like a submaximal to maximum. To people doesn't know the underlying diseases.
Right.
It's gonna be dangerous.
Yes.
Yeah.
So we have to start from, we have to know what underlying we have, what disease what we have, what complaint what we have.
Yeah.
Sometimes we want to exercise, just go to exercise, go with the group, cycling, 50K,
or
100,
join the class.
and then what?
Yeah.
Yeah.
Everyone's different.
If you heard the news lately, some people happen like they go to the group and then do cycling, and then the heart stop.
Oh
Yes,
my
I heard
God,
stories.
that's
Yes,
scary.
I heard stories
And
like
then
that.
gone.
Yes.
Oh wow.
That's very scary.
Yeah.
Right. Everyone should know their own
Their
limitations
limits,
and capabilities
exactly.
before you take part in it.
So I think it's really important to accept, to know your body limitation, to go for a professional trainer, to see a doctor as well, even for the assessment. So basically, we have to do exercise regularly. But despite of the things that we do as an exercise, we also do some, house cleaning, something like that. It needs some physical movement. Can it be categorized as a sport or exercise, Doc? Doing house cleaning or something? We get sweat
And
sometimes.
remember, by the way, I should tell you, Shafira has a robot vacuum cleaner. So I don't know how much housework she's
I
actually
have
doing.
to catch up my robot vacuum cleaner. How about that, Doc? Can it be categorized as an exercise? I don't think so.
Bad news, cannot.
Aha, I told you. I was telling you.
I don't think so. Okay, bye. I never do that again then. Okay, so
Right. We have to think about the terminology for the physical activity. What everything you do, when you use your muscle, that's we call physical activity.
Yeah.
All right? And then what kind of physical activity that have benefit for health, we call it exercise.
Okay.
But exercise have to measure, have plan, structure, and have a benefit. Have to have goal for increase the fitness categorized, like cardiorespiratory, muscle strength, muscle endurance. Have to have a goal to increase one of other fitness capacity. So we need to do an exercise.
Yeah.
Different in Indonesia, we call all that physical activity, sport, and exercise. We call it olahraga. Everything what
Yes.
we do, we call it
So
olahraga.
basically, we are working on our body.
That always confuses me. Sports and
Exactly.
exercise, it's the same word here in Bahasa. I always know. I always
Yeah,
bother
yeah,
me.
yeah.
It's two different things. Exactly, two
So-
different activities.
Now, here, Doc, let me ask you then. I'm sure if I ask you to list it all, I'm sure it's too long to list. So let me just ask you, what are some of the top ailments or conditions that you personally would prescribe mostly for exercise for? Like, for example, it could be physical or something internal. What are some of the most common ones that you would prescribe exercise as medicine?
There's some disease that will affect like diabetic. Diabetic need to do activator, right? When it's increasing, they cut off the muscle. So it's down. When the muscle is down, so we don't use sugar much more. So we have to build the storage for the sugar. We have to build the muscle, increase the signaling from the blood to absorb the sugar into the muscle. That's one. The second is hypertension. Hypertension needs very, very, very good circulation. We need to reduce the tension by the exercise with elasticity of the resistance of the blood vessel. If we do the exercise regularly, low to moderate, will reduce the blood pressure almost 10 to 20 millimeter Hg.
Right.
It's very good for the disease like that.
Yeah, I hear a lot of, especially here in Indonesia, maybe perhaps it's our nutrition, maybe it's the fact that we don't really have, nowadays it's better, but we never used to have places we can walk.
Yeah.
Everywhere we just take a car and we jump from taxi to taxi or
Exactly.
building to building. And I think that causes a lot of, type 2 diabetes as well as hypertension as well. So when it comes to something like an underlying health condition like this, how important is it and how often should we do accurate tests like body composition tests, for example? Because I was told you should do it every couple of weeks. Some people just say, oh no, if your levels are okay, just do it once in a while. I know people that don't do it at all. So what is your suggestion for us to know how much and how often should we know our own body levels and our fitness levels on the inside?
There is no criteria when you do it. I do it every day, I do it every week, I do it every 2 weeks. Some patients do it just every 6 months or just once a year.
Okay.
But if you have a goal, it's better you know the situation of what you chase or what you propose have to reach, right? It's better like this. My patient go to the hospital is like 2 or 3 times a week for exercise. Then I will do the examination every 1 month, 4 weeks, or 6 weeks. It's better. Or sometimes some patient want, doc, I want to do it every week. It's okay if you want it, but that's not much changing if you do every week.
Right.
But some patient, if we know the changing even a little bit, they're happy. And that encourages him to do more. To give it that to the patient, when or where that she wants.
Yeah, I check mine a little, kind of often, especially near the year end. My numbers change, but not for the better. After Christmas and New Year's, my fat percentage went up.
But I think it can help us to adjust with the
That's okay.
exercise,
I'll use
right?
it as motivation just to work
of
harder. You
course.
you can't let these numbers
Yeah,
get you
use it
down.
as
I will
motivation.
check it
Yeah.
then. So, doctor, is there any difference, I'm curious, between exercise accompanied by a doctor, team, or personal trainer, or regular exercise?
We see like when we do as a patient, right? We have to know the risk of the risk is moderate to high. Is better with a doctor. Because we don't have like clinical personal trainer in Indonesia. We don't have it.
Right.
Okay.
In other country probably have, but Indonesia don't have. So if you check, you don't have any condition, you can do training everywhere with anyone.
Oh, okay.
But if you have the risk is moderate to high, it's better you treat by a doctor.
Oh, okay.
So,
highly suggest.
Right, Doc, a lot of people are exercising at home the last 2 years, obviously because of the pandemic. And most people used to focus on body composition. I want to get skinny. I want to go to the beach with a
and sometimes
summer
I just want to get sweat.
Right. Yeah, but nobody goes to the beach anymore. Well, not often. And who cares about showing off a six-pack these days? I just want to stay healthy. So people are more focused on their immune system right now.
Yeah.
What are some of the suggestions, perhaps, for you, for people who exercise at home? For example, how often they should be exercising and what type of exercise they should be doing?
It depends the fitness level that you have. If you regularly exercise, you can do the mid to high intensity. It's no problem. It will increase your immune as long you know how to recover.
Okay.
All right, you have to good meal, you have to good sleep, you have to take some vitamins or to hydrate. It's better to hydrate. But some people don't really know how to exercise. That's gonna be a problem. So you have to start low, increase your knowledge for how to exercise, find expert, consultation with telemedicine if you need it, and then you can go. So starting from low to mid intensity for your time to invest your knowledge to how to exercise.
Yeah.
Oh, okay.
I think that's a good point as well. And a couple of points that people never notice. People always say, I want to get right into it. I'll get some dumbbells. I got a mat. I'm going to put on YouTube and I'm going to exercise. But they don't focus on rest and nutrition, rest and recovery and nutrition. And
that's the thing that you keep saying. I mean, this is the most important thing. It's only
not about the exercise. One side of the story,
exactly.
Basically. And a good point as well. You need to increase your knowledge. So don't just believe everything you see online.
Yeah.
Cross-check your facts. Make sure that there are more sources out there.
Don't just buy these tools at home.
Yeah.
You have
it's easy to do that. That's easy.
It's easy, but it's hard to try and, consistent to do it regularly to keep your health,
Okay, well, Shafira brings up a good point here, Doc. I'll give you one last question then. When it comes to consistency, I guess it's one of the most difficult things for people to do.
Tell me about it.
Right? So let's say she's been complaining about a back problem, but she's now with a personal trainer.
Yes.
But some people, once they're okay, once they feel better, it's hard for them to continue.
And I quit. I'm not doing it anymore.
Because the reason she's exercising
because of the injury that I felt. Yeah.
The injury is gone.
Exactly.
How does one stay consistent?
Yeah.
And how do you stay motivated to keep exercising so that way you do stay healthy?
Yeah.
Find a better mentor, I think. Find a better mentor. Because in Indonesia, we think like this. If you go to a doctor, and probably you have like hypertension, all right? You just say like this, okay, you can walk around the area for your apartment probably. You just walk. Probably you don't like to walk. I have a heart condition, but I don't like to cardio. I like to have weight training. So you need to find a mentor or the doctor that asks what you need, asks what you like, to put it what you like to the exercise regime. Right? What I said, you don't need what kind of doctor tell you have to do, but you need to doctor listen what you want and give you assistance and give you like an ideas what you like to give the exercise regime.
Oh, okay.
We can do exercise like weight training to increase your cardiovascular.
Yeah.
But how? But how? So the most problem, people don't want to do an exercise. There's so many research. There's only one reason.
That is?
People do not know how to exercise.
Oh, yeah, that's so true.
That's a good point. If you know how to do something, you're more excited about doing it, right?
Sometimes we do the exercise and end up with injury.
Yeah, right, and exactly. That's another part of it as well. And I think that's really important. That one of the ways I stay consistent is I do things I like. So if you exercise and you force yourself to do all these HIIT exercise, but you don't like doing HIIT exercise, then how long are you going to keep it up for, right?
Or I think I have a better motivation. Keep paying the membership.
Okay.
Because exactly, more you pay, and then you get, I don't want to skip because I pay already.
You don't want to fall into that trap. Or you can stay injured so that way you go. Doc, thank you so much for your time.
Thank you, doctor. Thank you so much.
Thank you.
Good luck to you. Stay healthy out there. We'll hope to talk to you again really soon.
Bye, Doc.
Have yourself a great day.
All right.
Bye.